Yes, I'm ready.
Good. Put the timer, Ali.
6 minutes, right? 6.
Yes.
Yes, timer in place.
Start.
Okay. Good morning. My name is Dr. Kamal. I'm one of the surgical team working here today. May I confirm your name and date of birth, please?
My name is Omar. My age is 25 years old.
Nice to meet you, Omar. Today I'm going to do examination for your tummy, and this is including looking, feeling, and do some special tests. Is it okay with you? First of all, you need chapel.
Yeah.
Okay. We will contain your dignity. Is it okay with you? Now, first of all, I'll expose your tummy. I'll do an inspection for you. You can see here, this is normal abdominal contour and no scars, no deformity, no masses seen. Now, I will do examination for your abdomen. If you feel any pain, please tell me, okay? Where do you feel matching your pain actually feel? Okay. I will be very gentle to you, okay? Okay. Now, first of all, into palpation, check the temperature, check tenderness. You feel pain here? Here you feel the pain?
Yes.
Okay, you're doing very well. I will be very gently, okay? Would you please turn your head to the left side? Take a deep breath, please. Would you please look up for me? Okay, where do you feel the pain now? Here, in this right side here, okay. Now, I will do examination for you. I will be a little bit deep palpation, okay? Okay? Okay. Gently. 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 You are doing well? Okay. You feel pain here? Okay. Okay. You feel pain? Okay. Now, I will do some other tests for you, okay? You feel pain here? Okay. Very gentle with you. You're doing well. Now I'll do some auscultation for you with my stethoscope. Is it okay with you?
Yes.
Okay. This is good. All right. I'm going to do some special test for you. Is it okay with you? Okay. You feel pain here?
Yes.
You are doing very well. Okay. We'll press the other side. Where did you feel the pain now?
Here.
Here. Good. Gently. All right. Where do you feel the pain?
Here.
Here. Okay. All right. Where do you feel the pain now?
Here.
Here. Okay. Would you please turn to the left side? Okay. Gently. Where do you feel the pain now?
Here.
The same side. Okay. All right. Gently. Let me check your pulse, please. Well, it is 90 per minute. Other hand, please. Okay. Right. Okay. Would you please now make your clothes? I will help you to take your clothes back, okay? Okay. Thank you so much, and I appreciate it work. And I would like to do rectal examination to complete my examination. Okay, I'm finished.
You still have 2 minutes. Do you want to do anything else, or that's all?
Just rectal examination to fulfill my examination and lymph node examination.
Okay, fine. Can you present your patient, please?
Well, my patient now I present, he's Mr. Omar. He's 20 years old. he had right side iliac fossa pain. When I do examination for him, there is rebound tenderness, there is not the abdominal region, no scars, and there is rebound tenderness. There is positive Rossing sign, positive Sawas sign, rebound tenderness, and positive obturator sign.
Okay. And reviewing the patient medical record, what did you see?
Sorry, I can't hear you.
Did you review the patient medical record?
Yes, when I see the medical record, I have noticed that his temperature is high, and he had elevated total white blood cell count, and he had that third point, I forget what he had. This one, yes, he had.
Fine. Okay. What's your primary diagnosis?
Probably my provisional diagnosis acute appendicitis in such a case.
Yes, Muhammad, look to me. Look to the camera while you answer. Yeah.
Yes, yes.
So, okay. And what's your differential diagnosis?
Other differential diagnosis from the GIT causes could be inflamed mucus diverticulum, perforated duodenal ulcer, could be perforated DU, and for other cause, for gynecological causes, he's a male. He's a male. That's for differential for me.
Yeah.
Okay.
Okay. And what's your investigation?
I would do general investigation for him. First of all, I will do CBC, total white blood cell count. And I've noticed in the record, for recapping, he had high elevated total white blood cell count. I will do urine analysis for him. I will do urea electrolyte for him. And I will do tumor markers at the erythrocyte sedimentation rate and C-reactive protein. This is for general investigation.
Okay. And what's your most specific investigation?
A specific investigation, we do a CT abdomen with contrast. But beforehand, we have to do ultrasound for the abdomen.
Of course, yes. And what's your treatment for such a patient?
This patient, he is symptom of acute appendicitis. We would do for appendectomy.
Appendectomy. And do you know what incision that we do for appendectomy?
What?
Incision.
Incision, there is lance incision. We do for appendectomy. And there is an old grade iron incision. We do this an open appendectomy. And also there is, if you can do lab appendectomy also.
All right, good. We still have 1 minute and a half. And the
differential for me, you ask me, he's a male because now we had about perforated U, infected meticulous hypertrophic could be other diagnosis, mesenteric lymphadenitis in such a case. Yes.
Okay, good. That's all for me, Muhammad. Good. I think the station from the start is the easy station. Appendicitis is not difficult at all, and it has a lot of questions. The question is already known. It will just take time, but it's a high yield one. Muhammad, I will start with you, then I will follow up.
Muhammad Kamal, you did very good. I would like to ask you, Muhammad, did you ask the patient to expose his chest for an inspection? Muhammad Kamal. Hello. Ali.
Yes, I asked him first, take permission, consent for that. I said to him, I will expose your tummy and your chest.
And you did the inspection for whole chest and tummy.
Actually, I imagine that I exposed the chest below the nipple line, from the nipple line up to the iliac fossa.
Yes, I'm asking about doing the inspection.
Yes, I have done an inspection for both of them, but actually, to be honest, I will concentrate in the abdomen, yes, mainly. Yes.
Also, I have one point about the general examination. I think you examined the patient hand for chronic liver disease, and you check the pulse, but I didn't think that you check his eyes and mouth.
Yes, I didn't do it actually. Yes, I forget.
Yeah, it is fine if you will start by general examination, as you want to determine if your patient in shock or septic shock as from perforation of
Okay.
the appendix. So general examination here will be the first, then abdominal examination. That's all what I
General
have.
examination first. Okay. Okay.
But otherwise, you did very good, Muhammad.
Muhammad, your presentation is very fantastic. And
Yes.
that's a pass for sure. The question about appendectomies are not that much. For you, there's a couple of it's not a mistake, but I think a couple of things that we could do better. For example, you can when you ask your patient, could you please do cuff for me? It's better to say,
Yes.
could you please cuff for me? Just could
Okay.
you please cuff for me? Not do cuff. It's not do cuff. Could you cuff
Okay.
for me? When you are practicing, I just want to make sure that that's why we put the timer on. That's why we make sure that it's the same as exam. If you have a
Yes.
stethoscope with you, bring it. If you have a stethoscope, bring it with you.
Yes,
So
I don't have actually. Very sorry. I'm deeply sorry. I didn't find it. Yes.
Yeah, that's fine. And when you presented your patient, you said, when I do, or at the start of your presentation, you said, when I do clinical examination on this patient, the better answer should be, I conducted or I perform clinical examination and memorize this so you don't think about when you examine the patient.
Okay.
When you
Okay.
finished, you still had 2 minutes. But I asked you, do you have any other thing or anything you want to add? You said no. But you could say, I would like to take the medical record. For acute appendicitis, for acute
Correct.
Yeah,
cholecystitis,
the chart. Yes.
The
say
chart.
I
Okay.
will, say I want to take the medical record immediately after
Okay.
you finish, especially when you have time. Okay.
For whole acute abdomen, acute cholecystitis, acute appendicitis, and diverticulitis. When you finish your examination, ask for a chart. Is there any chart, any investigation after you finishing your examination?
Okay. Okay. That's why I have read it actually from the school, but I didn't understand this point. Sorry. Yes.
Yeah, it does need explanation. That's why I'm just editing it now. Say at the end of the examination, I would like to take the medical record.
Okay.
Okay. Okay. I will add it in the. Okay.
Yeah.
Thank
Okay.
you.
Ask the rest of the group if they have any question before we go to the next. But Muhammad, all good. You are doing fantastically well.
I appreciate it, both of you. Thank you, Doc.
We can make the question at the end, Ali.
No, I don't mean question. I mean if they want to add anything, if there is a new question.
You mean about the examination?
Yes, of the acute appendicitis.
Okay.
Anyone from the group before we leave to the next?
Okay, the next station is paraumbilical hernia.
Hajar, I think.
Paraumbilical hernia.
Yes. Let me put the timer. Okay, let's start.
Should I start?
Yes.
Okay. Hello, I'm Dr. Hadir, one of the surgical doctors working here. I confirm your name and age, please.
Hello, doctor. My name is Suzanne. I'm 45 years old.
Nice to meet you, Suzanne. Thank you for coming. Today, I'm going to examine your tummy. This includes me looking, feeling, and doing some special tests. Is that okay with you?
Yeah, that's fine, doctor. That's fine.
I want you to tell me if you feel any pain in your mind. And let me know immediately, okay?
Yeah, okay, that's fine.
Do you need anyone to help you?
Sorry?
Do you need anyone to help you?
No, I don't need anyone to help me. Thank you.
Okay. So I will start by looking at your hands. Can you show me your hands?
Yeah, I'm showing you my hands now.
Okay, thank you. Can you bring your fingers together like this for me?
Yeah, I'm doing that.
Okay, great. You are doing well. Can you show me your palm like that? Great. Now can you extend your arm for me and let your hand on Then let it go slowly. Let it down slowly. Yes, good job. Well done.
Yeah.
Now I'm going to check pulse. I want to check the blood pressure. I want to see your eyes. Can you show me your eyes? Can you show me your eyelids, please? Yes, thank you. Can you look upward? Yes, well done. Can you show me your tongue? Yes, good. Can you take it off? Yes. Now, Suzanne, we are going to expose your chest and abdomen so I can look and do some examinations. Is that okay?
Yeah, that's fine.
Okay, exposing my chest and abdomen. I need you to sit without this. Is that okay? Okay.
Yes.
Thank you very much. I will just have a look at your abdomen from behind and from there. Okay, good. Now I'm going to check your temperature. Please tell me if you feel anything. Yes, great. Now I'm going to touch your abdomen. If you feel any pain during any step, please tell me. You are doing great. Can you cough for me? Again? You are doing great. Now I'm going to press more, but I will try to be gentle. Can you cough again? Thank you. Okay, you are doing great. So I'm going to tap on your abdomen. That will not be hard. Okay, great. Can you tilt to the other side, please? Thank you. Then waiting for 30 seconds. Okay. Okay, great. Now I need to listen to your abdomen. The bowel sound for 2 to 3. The bowel sound for Kui. And then I want to listen to the parambilical tone. Okay, great. Okay, great. Now I want you to lift your leg and slightly and take a deep breath for me. Okay, you are doing great. I want to complete my examination by doing the rectal examination and check her genitalia.
All right, we still have 1 minute and a half. Do you want to do anything else?
I made you respiratory examination to exclude any causes of chronic cough.
Okay, what else?
I'm searching for other risk factors such as
Hi.
patients
Tahar, please mute yourself.
hyperplasia.
I'm taking you. Yalla. Bring your monitor and come. And stethoscope.
Tahar,
Get
please
the
mute
stethoscope.
yourself.
Oh, sorry.
I want also to see the other hernia orifice. I'm going to download browser a little bit. Can you cough again to me? Thank you. Thank you. You are doing a great job. Do you need me to help you to cover yourself?
No, that's fine.
I think time about.
Okay, thank you for coming.
Okay, can you present your patient, please? Let me just put the 3 minutes first.
Okay, today I did examination for Mr. Sudan. She have para-umbilical bulging about 3 times 4 centimeters. It's not painful and it can be pushed downward. It's not attached to the skin or other structures and not attached to the down muscles. She had no signs of ascites or other risk factors.
Okay. All right.
And she have no.
So, what's your professional diagnosis?
It's a paraumbilical hernia.
Paraumbilical hernia. Okay. What's your differential?
It may be lipoma, maybe hemangioma, maybe malignancy.
Okay. How would you investigate your patient?
I will start by doing the general preoperative examination, and then I'm going to do imaging. In imaging, I'm going to do abdominal ultrasound and abdominal X-ray, with chest X-ray and rectal ultrasound.
All right. And how will you treat the patient? Put in mind, you said femoral hernia, right? That's what you said.
I didn't hear you.
How will you treat your patient if it's paraumbilical hernia?
Regarding my treatment, it's either be laparoscopic or open herniatomy with mesh.
Laparoscopic?
Or
Okay.
open with mesh repair.
All right. Do you want to do anything else?
I want to modify firstly her lifestyle and treat the underlying cause. If the patient is a heavy lifter, I will advise her regarding her job. And if she is a smoker, I will advise her to stop smoking. And if she had chest infection, I will refer her to respiratory consultant. No, that's all.
Fine. You said you have surgical option. One of them is open or laparoscopic mesh repair. Where to insert the mesh repair in the open surgery? Where to insert the mesh?
Intraabdominal.
Okay. What's the indication of laparoscopic herniatomy?
Either it's recurrent hernia or bilateral.
And what's more liable to strangulation and why?
The paraumbilical hernia, because it has a nerve defect.
Okay, good. Good. Muhammad? Muhammad? Okay, if Muhammad is not here, let me do maybe his internet.
Ali?
Okay. Yeah, Muhammad.
I think I lost my internet connection. Hajir?
Yes.
You did very good. I just have one point regarding your examination, which about the when you are doing the deep palpation, you need to check the size of the defect of the hernia. Important point.
Yes.
Yeah.
Yes, I did it by checking the borders. Yes.
The
Did
defect.
you measure
The
the,
defect.
did you measure the
You need to
The
insert
borders.
to determine by your
Yes, I
finger
tried.
how many fingers, 2 fingers, 3 fingers, the size of the defect.
I just try to put my hand around the edge and to see how it steps.
No, I don't mean the size of the hernia. I
No,
mean
I
the
know
size, the size of the defect
of the defect. Yes, I get it.
by which hernia found it, okay? By finger, 2 finger, 3 finger, like that.
Okay.
Otherwise, I don't have any comment about your examination. You did
yes,
very
I have. Yes, yes. So do you know where to listen for the vowel sounds? I'm gonna ask
Yes.
you now.
Yes. Above the umbilicus, the right and left side.
Right and left side. And if I told you just to,
yes.
if I told you which side would you prefer, the left or the right? If I ask you to
think
choose one side.
it depends. I think it I think it depends on either the jejunum or duodenum.
Yes. Okay.
Small bowel.
Right. Yeah.
Yes, right.
But as a general, yeah, if you have to choose the right or the left, you choose the right.
Okay.
But on the exam, take the right, take the left, take above the umbilicus, and take 4 points.
Yeah.
You know the 4 corner of umbilicus, take all of them.
Okay.
When you presented your patient, you said, I would like, yes, I asked you 3 times after you finish what you want to do. You still have time. You didn't say I will take the record. I know
Yeah.
it's not on the scope. I'm gonna add it now, but you
Okay.
should say I will check the record.
Okay.
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 Mention
Ali,
that to the examiner. Yes.
do you have any point? I just have one point. I remember it. Listen, Hajir, when you
Yes.
are checking the patient eye for any sign of jaundice, tell him that you need to gently press his eyelids downward. Okay,
Okay.
Mr. Jack, I will gently press your eye downward. Take a
Okay.
look. Okay.
Excuse me, Dr. Mohammed, why you press it? That's a question for you.
About the eyelids?
Yes, with this examine. Yes, explain for me. With if
Yes, this is for checking for anemia.
okay, you wanna examine conjunctiva, you mean?
Yes,
Examination.
yes, what that I mean.
Okay. I thought that it may be like maybe intraocular pressure. That's why I
Also
didn't understand.
for jaundice, also you
Right.
ask the patient that you will raise his eyelids upward when you're checking for the
Yes.
jaundice.
Totally agree. Totally agree.
Yes.
Thank you.
The next
Okay, I have
okay.
just
Ask.
a simple comment. Yes. On school, it's not written that about anything about the defect itself. So I recommend to write more about the defect, how and you have to measure it, and to
I think
see the
Hajir is
depth
written.
and
Check the
bound.
school, please. I updated.
Yes, I'm checking it.
I updated today and add the defect checking.
Okay.
I updated today.
Okay.
Okay.
Okay. Thank you.
Thank you.
Let me check. All right. Good. The
Does
next
anyone
one
have
is the
question?
iguanas.
Okay.
Question or comment
All
before
right.
we go to the next.
The next session is inguinoscrotal hernia. Who will do the inguinoscrotal hernia?
It's already prepared. I'm going to start hernia الفاتح.
السلام عليكم. مساء
الفاتح.
الخير.
عليكم السلام ورحمة الله وبركاته.
والسلام ورحمة الله وبركاته. أول مرة أظن تخش معانا صح؟
لا
ما تعمل
أول مرة
examination.
أقدم.
جميل.
يا أول مرة تقدم.
ليش على
امتحانك متى؟ When is your exam الفاتح؟
إن شاء الله will be in October لندن سنتر إن شاء الله.
Good.
بالتوفيق.
حتلقى أنا قاعد هنا إن شاء الله. You'll find me here. You will find me here.
تعالى
London.
كمان قبل الامتحان.
Support. نعمل لك support.
والله.
Ali put a timer for 6
Let's do
minutes.
it. Okay.
Fatih, are you ready?
Yes. Stop.
Start.
Hello, I'm Dr. Fatih. I'm medical research today. I understand that you have lower abdomen lump. I'm gonna examine this lump. This include inspection and feel and do a special test. Is that okay, Mr. Alex?
Yeah, that's fine, doctor. No worries, that's okay.
Do you need anyone to be with you here?
Yeah, I would like one of the nurses to be a chaperone.
Yeah, welcome. You and her is welcome.
Okay.
Nurse, could you please come to share us this examination?
Yeah, that's fine. He came already.
Mr. Alex, do you mind? Would you mind to expose your abdomen and chest, please, for me?
Yeah, I'm doing that now.
Okay. Can you give me a cup, please? Okay. Is it cause any pain for you or not?
No pain, to be honest.
Okay. Now, Mr. Alex, I'm going to examine this lump.
We don't see you, Al-Fatih. I'm not sure if you are intense. Yeah, now we can see. But in the last 10 seconds, I didn't see you. The screen was blank. So are you examining a below or anything?
معلش أنا ما سامعكم. كنت شنو؟
I don't see you.
Okay.
I don't see you.
Now you are seeing me? Now.
Yes, now. Just now. You disappeared
Yes.
again.
Wait, please. I think I will. I want to move remove this effect. Yes.
You know what? Make it the usual background. It
Yeah,
doesn't matter.
Al-Fatih is
minute.
okay. You can do
Just
this
the,
background.
yeah, but he disappeared, Muhammad, frequently. He disappeared frequently. I stopped the timer anyway.
معلش يا شباب بس ثواني. Be patient
No
with me.
worries. We are very patient. We're gonna start it from the beginning.
Yeah, okay. Okay.
Yes. Let's
Now?
start from the start. From the start.
Okay.
Okay. Okay. Let's start.
Hello, Mr. Alex. I'm Dr. Al-Fatih. I'm one of the registrars. One of the certificate registrars today.
Hi, doctor.
I understand that you have lower abdomen lump, and I will examine, and this involve inspection and field and do special tests. Is that okay with you, Mr. Alex?
Yeah, that's fine.
Okay. Do you want anyone to attend
Yeah,
with you?
I want one of the nurses to be a chaperone patient.
Okay. Okay. This is okay. Mr. Alex, would you expose your abdomen and chest, please, for me?
Yeah, I did now.
Okay. Give me a cup, please, Mr. Alex. Okay. I'm going to touch this lump. If you feel any pain, just tell me, okay?
All right.
Okay. My hand is not, what I am doing is not clear, right?
Yeah, that's fine. Just take the phone with your other hand and do with the one hand. Yeah, okay.
Okay. Can you reduce it for me, Mr. Alex, this lump? Can you reduce it?
I will try to do that now.
It is reducible. So it is reducible. Give me a cup, please.
I don't think so, but that's fine. It's what you think. Yeah, I'm going to give you another.
Okay, thank you. Thank you very much, Mr. Alex. And Mr. Alex, if you don't mind, I am going to expose your scrotum to examine it. Is it okay with you?
Yeah, that's fine.
Yeah. Scrotum. I'm going to leave it.
ايه اللي حصل يا احمد؟
Sarah, please mute yourself.
Okay. Thank you, Mr. Alex. Can you now you can dress your clothes and come.
Okay. I'm going to dress now.
Thank you very much.
Yeah. Are you done with your examination?
Yeah. I examine.
Before you present, you have 3 minutes.
Yes, I would like to do a consultation for proving.
Performing.
Yeah, and check the inguinal.
No, do your auscultation. Do your auscultation. Yeah. Okay.
Okay.
Yeah, good.
Also, I want to check the inguinal lymph node also.
Okay, can you take it, please?
Okay. Okay, done.
Fine. Okay. Can you present your patient? Before you present your patient, you still have 2 minutes. Anything
Okay.
else you want to do?
Yes, Mr. Alex, can you confirm your date, please? Your date of birth or age?
26th of November 1998.
Okay, thank you.
Okay. Can you present your patient? Doctor, please, let me put the time again.
Examine this gentleman, Mr. Alex, who has a lump. It is 4 by 5 centimeter. It is reducible and firm in nature, and not attached to the underlying structure or the skin.
Okay. What's your main diagnosis at the moment?
My diagnosis is one scrotal hernia.
Okay, and what's your differential?
It may be femoral hernia or epidermoid cyst or scrotal or testicular cancer or hydrocele.
Okay. And what is your management for the main diagnosis of yours?
For the main diagnosis is maybe open surgery or laparoscopic surgery.
And what's your choices for the laparoscopic?
What is what?
Your choices for laparoscopic. What's your options for laparoscopic?
Okay. My option is trans-abdominal periperitoneal repair or total extra periperitoneal repair.
All right. TAP or TEP. And
yeah.
What are the complications of the open surgery?
Postoperative numbness and postoperative pain.
All right. And what's the indication for laparoscopic repair?
The recurrent hernia and also a bilateral hernia.
Bilateral hernia, fine. We still have 1 minute, so I'm going to ask you a couple of questions about different disease. What is hydrocele?
Hydrocele is a collection of fluid, is a tunica vaginalis.
Okay, and what the types that you are aware of?
Maybe congenital or transcommunicating and communicating and not communicating hydrocele.
All right. And do you know any other classification for the hydrocele?
Yeah, it is maybe congenital hydrocele, cord of the hydrocele, hydrocele of the cord,
okay,
and infant hydrocele, infantile hydrocele.
Yes, good. Which hydrocele has negative transillumination test?
This is non-communicating hydrocele.
Okay, and how will you investigate a patient with hydrocele? Specifically the blood and the enzymes?
Okay, I will do I will do abdominal ultrasound and CRB, and CBC, and also I will do alpha fetoprotein LDH. And
okay, and that's fine. What's the investigation you will do to exclude any tumor? If you want to exclude a malignant
abdominal, okay, I will do abdominal ultrasound, scrotal ultrasound, and Doppler ultrasound.
Will you do any
and
hormone?
Fetoprotein and fetoprotein and HCG.
Yeah, human chorionic gonadotropin. Okay. Diagnostic aspiration should be avoided at all. We should not aspirate from a scrotum.
Yeah. To avoid the spread of the malignancy.
Okay. And how will you treat a patient with hydrocele?
How will what?
How will you treat a patient with
Okay.
hydrocele?
I will do conservative management for that of non-symptomatic adult, and that for patient no less than 2 years old, and surgical for symptomatic, and also for any child over 2 years old.
Okay, and what the operation that you will do for the treatment of the hydrocele?
I will do planification and
Okay.
Lord and Jabuli and excision.
What do we call Lord and Jabuli? What do we call them? Like, what the concept of them?
Lord and Jabuli procedure. It is
Both of them are eversion.
eversion. Okay.
Good, good. Cool. Let's come to the discussion, Fatih. Okay, I'm
Okay.
going to start, Muhammad, and then I will let you
Fatih,
continue.
this is the first
Muhammad.
time you introduce yourself in examination. Very good.
Yeah.
Yes.
Very good.
Very good. Presentation. Your exam is in October. We still have a lot of time. Firstly, you started the first station before we record. Fantastic. When we came to the next, you had a bit of anxiousness. I don't know why. You became a bit stressed.
بس عشان هنا الباك جراوند حاولت اشيلها ما قدرت.
Yes.
ففعلا عملت لي ستريس في الاول.
يلا فما بالك بالامتحان. فعشان كده that's cool we are participating. We're going to be more stressed in the exam. So I'm glad that happened. You presented yourself, but you were not I'm not talking about the first one. I'm talking about after we repeated it. You were not that confident. You came a bit less confident. You say, "Hello, my name is El-Fatih. I'm one of the surgical doctor working here. Can you confirm your name and age, please?" Your energy was a bit low. I don't know why, because you were already stressed. Yes, the next time, not the first time. You asked all the questions. I think you forgot the transillumination.
Yes, yes, forget it.
Did you
really?
You forgot the transillumination?
Yeah, yeah.
You asked me at the end. I reminded you of the auscultation. You didn't figure it out yourself. I asked you twice. Is there anything you want to check? Is there anything you want to check? Then you will remember the auscultation.
Yeah. I remember the auscultation and inguinal lymph node.
Okay, good. You asked the patient to dress himself, or did you offer help to the patient? I'm not sure. I'm gonna go to the record, but I think you asked the patient to dress himself. You didn't offer your help. Did you ask the patient? Okay, now do you need any help for me to dress?
I asked him to dress, but I asked him to dress his clothes, but I didn't ask him about the help.
Yes. So it's more professional to say to the patient, "Okay, Mr. Alex, do you need any help with your dressing?" Probably he will say yes or no.
Okay.
Okay.
At the end, I take the scenario to the hydrocele. Your exam could be each of these. It's not important about which one will come to your exam. It's more about
about the examination itself. Yes.
It's very common station. It's how you approach it.
Yes.
It's how you approach it. So next time when you practice with Al-Fatih, I want you to elevate your energy. A lot of people will start the exam in a very high spirit, and then they will lose the energy because they will.
المرة الأولى كانت ماشية كويس، لكن بس موضوع شايفني.
Yes, exactly.
يمكن يكون عمل الاسترس.
Exactly. Yes. Yes, exactly. Yeah. Imagine, okay, in the exam you will find that you will have a station that you will think you failed on.
Okay.
And so you train yourself to work under pressure and under stress. I don't have a lot of point. I think you just put yourself in a difficult situation. You ask most of the all of the questions, except I think the only big mistake is the forgetting the trans-elimination. I think that's the only big thing.
So Ali, I will ask him, Muhammad,
Yeah.
Muhammad Al-Fatih Ali, how you will do the
Yes.
transillumination test while patient is standing or sitting? Which is best one?
While patient is standing. I think.
Yes, perfect.
Yeah. In slightly dark room, right?
Yes, yes. Before ask patient to lie down, do the transillumination test for the scrotum.
Okay.
Thank you.
Good. Anyone has any point? And Al-Fatih, did you revise it quickly from our school, because we added a lot of pictures to make it easier about the bullies and Lord.
Yeah. I just read it from the school, not any other source.
Okay, and I'm just asking the rest, Muhammad. What do you think about the general examination of the jaundice? Should we do that in the inguinal hernia, or it's not required?
No, it's not necessary to do the
The-
whole abdominal examination. It's just about the
Okay.
hernia and the scrotum. Is it indirect inguinal hernia or direct inguinal hernia? Muhammad, also, I remember, did you determine the lump, is it medial to the inguinal ligament or lateral to inguinal ligament? It's a crucial point. Muhammad, Al-Fatih.
Yes.
Did you determine the site of the lump? Is it medial to the... Yeah, okay.
Yeah,
Yes.
between
Yes.
superior spine and the pubic tubercle.
Yes, excellent.
Yeah.
Okay, the next station is respiratory examination.
Respiratory examination is
I think it's an easy one.
Yes, it's me.
Are you
Good.
ready, Sahar?
Let me open it.
Sahar, are you ready?
Yeah, let's
Put the
let me
timer,
put
Ali.
the timer.
Hello?
Hello.
Put the timer, Ali.
I did.
So,
I did put the timer.
Start, Sahar.
okay. Hello, I'm Dr. Sahar, one of the surgical doctors. May I know your name and age, please? Can I have your name, please? Hello, Ms. Shanti. How are you? Ms. Shanti, I know about your history of chronic obstructive pulmonary disease, and you're here for your pre-operative assessment for the hernia repair. I would just like to examine your chest today. That may include me looking, feeling, and doing some tests. Is that okay with you? Okay. Do you need a chaperone with us? No. Okay. Ms. Shanti, I need also your permission to expose your chest while examining your chest. That okay? And do you have any pain right now? Are you uncomfortable in any way? Okay, thank you. Ms. Shanti, can you please lay down for me? I'll just take a look from the end of the bed. Can you guys see? Please give up.
Yes, yes.
Okay, so I will have to stand at the end of the bed. Can you, Ms. Shanti, please cough? Okay. Can you please take a deep breath? Okay, thank you very much.
Please mute yourself.
Okay.
Okay, Ms.
Continue.
Shanti, now I'm just going to take a look at your hands. Can I do that? Thank you very much. Thank you. Can you turn them over, please? Okay, I'm just going to press slightly here. Sorry if I'm causing any discomfort. Okay. Can you do this, Ms. Shanti? Can you just copy me? Thank you very much. Now I'm just going to enter your pulse. Okay. Thank you very much. I'm just also going to measure your respiratory rate. Thank you very much, Ms. Shanti, can I just put this on you, please? Thank you very much. And I'd like to measure your blood pressure.
Keep it. Skip the blood pressure, Sahar.
Pardon?
Skip the blood pressure.
Thank you, Ms. Shanti. Okay, Ms. Shanti, can you pull your eyes for me? Thank you very much. Can you open your mouth? Stick your tongue out. And stick your tongue up. 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 Thank you very much. Okay, now, Ms. Shanti, I'm just going to be touching, feeling for your windpipe and some examination. Okay? Okay, thank you very much. I'm just going to feel for some lymph nodes on your neck. Thank you very much. Now, Ms. Shanti, I'm going to place my hand and ask you to just reach again. Thank you very much. Yeah. Thank you very much. One last. Shanti, I'm just going to be tapping on your chest right now. Okay, that may feel a little uncomfortable. If you have any pain, do that. So start supraclavicular. Clavicle. Thank you very much. Miss, can you just place your hands on your hips and put your elbows forward? Thank you very much. Now, Miss Shanti, I'm going to listen to your chest. Okay. Please, with your mouth open, I need you to take a deep breath. Thank you very much. Thank you very much. Again. Again. Shanti, can I ask you to sit up? And I'm going to repeat some steps on your back, okay? Okay, again. Thank you very much. Yeah. Okay, I'm going to be tapping on your ribs, okay? Again, if you have pain, do let me know, please. Thank you very much. Shanti, I'm going to ask you to take a deep breath with your mouth open. Again. 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 Can you please say 99? 99. Again. 99. Again. 99. Again. 99. Again. 99. Again. 99. Okay, you may lay down. Shanti, thank you very much. Say 99, please. 99. 99. 99. 99. Now I'm just going to listen to your heart.
Time finished.
Pardon?
Time finished. 6 minutes passed. Good, doctor.
Thank you very much, Ms. Do you need help with dressing you up? Thank you very much. I'm going to wash my hands and I've completed my examination.
Good. Can you present your patient, please?
Yes, I've examined Ms. Shanti. She's a 65-year-old. And she has a history of COPD, likely to her loss of smoking. So, and in the absence of cyanosis and the central trachea, and the COPD.
Okay. And what's
differential
your
with
differential?
asthma.
You don't have it. Yeah. asthma, but she's already diagnosed as COPD, right?
Yes.
Okay, and how would you manage the risk associated with surgery for this specific patient?
So I would communicate closely with the anesthetist, particularly the one who's over her case, to ensure that the anesthetist is aware of Mrs. Shanti's COPD and to make sure we're covering all the risks.
Okay, and from practical point of view, what would you do with the anesthesia?
Okay, so
to make sure the patient is safe?
Preoperatively, I'd do a chest X-ray, a spirometry to exclude any the X-ray to exclude any pneumonia or
Look to
malignancy,
the camera,
and
stand yourself
spirometry
to
and
speak to the examiner, eye to eye. Sahar. Yeah.
Okay. Mm. And obtain an arterial blood gas and do a spirometry, I said, and optimize the medications, the COPD medications if the patient is smoking. So stopping smoking would help as well.
Okay, that's preoperatively.
Okay. Yes, and intraoperatively, I would advise, or the patient should go for an open surgery rather than a laparoscopic to avoid pneumoperitoneum risks on the lungs. And regional, I also prefer a regional anesthesia to lessen the complications post-operatively. And the post-operatively, in the pre-operative period, also would conduct a chest physio, and that would continue post-operatively as well.
All right.
And after the surgery, the patient would be shifted to an HDU unit for close monitoring and manage the respiratory status.
Mention 3 possible post-op complications for this specific lady.
Pneumonia, ARDS, and atelectasis.
And how to assess respiratory sounds? In general approach.
Okay, so equal heart sounds are usually bronchial, supraclavicular, and infraclavicular. They would be vocal vesicular breathing. And if the patient has consolidation that may affect the percussion and auscultation, there would be hyperresonance on auscultation, and percussion would be dullness, or if there is fluid as well. If
fine.
The patient has...
I think we still have 30 seconds, but that's not a very high use question. That's why I put it off. Okay, Sahar. I think you performed very well. Grammatically, you asked every single question in the right way.
She didn't miss any point about examination.
Yes, I don't think she missed any point. And I just want to re-emphasize a very good point you just did now. Even though your time is finished, you still thank your patient and you still offer to dress her. And I think that's very important. Even if your time finished, still take the first 10 seconds of your 3-minute discussion to thank your patient and offer to dress him. What you did was brilliant. That's very good. I just before we go to Muhammad and to the rest of the group, I want everyone to open the examination of the respiratory for me, please. Everyone from school, and I want to ask you a quick question before we complete editing our material. Please open your. I want to hear you guys that you are doing that. Can you open the respiratory examination for me, please?
Okay.
Okay, when you open the respiratory examination, go down there to the last part of it. You will see the question of the examination, 3 possible post-op complications. There is pneumonia, atelectasia, and ARDS. ARDS in the blue color. Do you see it?
Yes.
Okay, press on the blue color. It will take you to the ARDS lecture. Okay? Did you do that?
Yes.
Amazing. Amazing.
Okay. I just wanna know if this distract you from studying, or this will help you guys. Do you want us to continue editing the same way, or you want every single lesson to be separate from the other lesson? For example, we can make all the school integrated in the same way. For example, you study here, this will help. Are you sure, Hajir? This it will help, but it will help, but it could be also a source of
Of
what they call it,
interruption, yes.
interruption.
For me, I
think-
vote
Yeah.
for continuous, but I didn't know actually this will press it. It will open a new window. That's why.
Ali,
Yeah, but Muhammad Kamal, do you think this is a good idea? Because we
This
can
is
make all
it's
the
a brilliant idea for me. It's a brilliant idea, not a good idea.
will it distract you? For
No,
example,
no.
I
For
think-
me, it more expression for me because sometimes you don't need to write the same. You are focusing on some subject and there is another subject. That's why not to interfere. You can just add a comment, please.
Muhammad
In blue
Kamal.
color.
I agree with you,
Yeah.
but there are other sides, because when you start reading history and found like this, then you will go to the critical care stations.
So
If-
yes, I am following you. Yes. What's your point?
My point is you are planning to study history, to study 1, 2 to 3 sessions about history. Then you will find yourself in the critical care.
But my point is, with all respect to your opinion, Dr. Muhammad, my point is, he just put it in the blue color. If you want to add more,
Hajir added point,
I think-
excellent point.
yeah,
Then
I-
don't press it.
I think Hajir is right. I think
Yes,
Hajir,
yes. He answered all questions.
yes. Then don't press it. I prefer the knowledge to be related. Yeah, don't press it unless you need it. I think you are totally right. Don't press it unless you need it. But I didn't hear from the rest of
That's
the
what
group.
I mean. Yes.
Yes, Muhammad Kamal Al-Fatih. Hind Sahar. You didn't say your opinion. Salma.
I think connecting to other topics, I mean, the same topic in another, even if critical care, pathology, whatever it is, we still have to go through all topics. So it's not a distraction at all. Maybe it's a refreshment for our whatever knowledge previously.
All right.
And actually, I was doing the examination and I came across the clubbing. I thought or I imagined you're going to ask me about the pathophysiology of clubbing. So I went to the pathology and read about it. So this is very good, actually.
Okay, that's fine. But the point will be we should emphasize enough, as Sahar, as Hajar said, don't press it unless you need it.
Right.
Because it could distract you in a way, and that's fine. And we will not do it unnecessarily. So Muhammad, we have a job of connecting all the schools together. We're gonna start from today. That's gonna be a lot of work. Fine, cool. We just want to make sure it's helpful. Okay, let's go to the next. Let's go to the next.
Cardiovascular examination. The next session is cardiovascular examination. Selma Zahran.
Yes.
This is station for you, right?
Yes.
Should I start now?
Wait, let Ali put timer, please.
Okay. Yes, you can start.
Good morning. I am Salma, one of the surgical doctors here. Can I confirm your name and age, please?
Hello, doctor. My name is John. I'm 55-year-old.
Nice to meet you, Mr. John. Mr. John, I want to
your connection is not stable, Salma. Your connection is not stable. If you are on Wi-Fi, ask who's ever in the house to not use the Wi-Fi while you're doing the session.
No it's a good signal.
Is it just me, guys, or everyone is finding it difficult to follow it?
Now it is clear.
Poor, still poor.
Hello.
Hello,
Yeah, I
Salma.
can hear you. I can hear you, but it does. Yeah, it does fluctuate. Yeah, it does fluctuate.
Salma,
Okay, Muhammad. I think. Look. Let's go to the next, and let's tell my
we have no next
connection.
stations. This is the last stations. We have crisp.
Are you sure?
Yes,
No, we have a station.
we have two crisp station, but I think there no
we have
one take these
gynae-
stations.
we have gynecomastia for Asia, Muhammad, and we have cranial nerve.
Where are the Asia?
Yeah, here Haji wrote it yesterday, like 3 days ago. Respiratory
Hagel will take cranial nerve.
gynecomastia.
Hagel will take the cranial nerve.
Cranial nerve Asia
not
will
attend
take the
this
cranial
station.
nerve and gynecomastia.
Asia not
Asia
here.
is here, right?
No.
Okay. Asia is not here.
Excuse me, Dr. Ali, can I have one question for you?
Yes.
I think that you are right. There is gynecomastia and there is cranial nerve, but maybe I don't know Asia's name. Her name is she here or not? My suggestion is give 1 minute, please, if you don't mind, for our colleague that will present her cardiac examination, because she's trying to.
Yes.
Of course. Yeah, of course. I didn't at all. We will not escape her. I was just thinking if we can go to someone and come back later on to her. You know what I mean?
Salma.
So if we can go to do the station and then come to Salma for the cardiovascular.
About the other station, Ali, Asia didn't attend the session. So the gynecomastia and the cranial nerve examination.
That's a problem, Muhammad. Her name is already written. She needs to there's two stations. Anyone can take this station, gynecomastia. You can just do it on the what they call it.
can do the cranial nerve.
Yeah, and we want someone else to do that. Gynecomastia can do it on a pillow. Just put a pillow and examine the pillow if that's possible. Sahar is here.
Yes, Sahar here.
Sahar. If you don't want to appear fully to the camera, you can just let your hand appear. That's fine for us. Okay. Selma, I'm checking with Selma to see if her connection is back or not. Selma Zahran.
Hello, it's clear. Hello.
Selma. Yeah, I can hear you now. Let's see. I think it's better now.
Okay.
Or still up and down. Muhammad, can you?
Yeah.
Selma,
so we'll start by
the start.
Selma.
Yes.
Okay.
Start, please.
Let me put the timer.
Morning.
And what we're gonna do, Muhammad?
One of the surgical doctor.
Yes.
Confirm your name and age, please.
Hello, doctor. My name is Chris. I'm 45 years old.
Nice to meet you, Mr. John. Today, I will be your doctor and I will examine your heart. This examination, including me feeling, listening, and doing special tests. Is that okay with you?
Yeah, that's okay. But I told you my name is Chris, and you called me John. That's strange to me, doctor.
Sorry, I can't hear you.
I told you my name is John. My name is Chris, but you called me John. I don't know why.
Chris.
Okay, okay, Chris. Sorry for that.
Yeah.
Do you need any chaperone, Chris?
No, that's fine. No need.
Okay, okay, Chris. Can you take a deep breath? Thank you, Chris. Chris, I just want to take a look in your lower limb and gentle press on it.
Okay.
Chris, can you look down, please? Now, can you look up? Thank you. Can you open your mouth, Chris? Nice. Now raise your thumb up. Thank you. Can you show me your palm in front? Yes. Thank you. In the back. Yes. Now, Chris, I will check. Thank you, Chris. Can you do like this for me? Thank you. Now I will count your pulse.
Okay, let's say 1 minute pulse.
Now synchronous and radiofemoral blade. Thank you, Chris. Chris, can you expose your chest and abdomen, please?
Okay.
Thank you. Just a little press. I will check your temperature. Thank you. I see midline scar here. Chris, I gonna palpate you. Can I lean you to the left a little bit? Thank you.
Yes.
Now I will put you in 45 degrees. Just turn your head to the left side.
Yeah.
Okay, thank you. Okay. Chris, I want to check your blood pressure now.
Okay.
Okay. Now I will auscultate your heart beat using this stethoscope. Now again, I will turn you a little bit. Thank you. Now I need to examine his abdomen to see if there is any liver congestion. So I want to do liver scan.
Okay, you still have 1 minute and 50 seconds. You still have 1 minute and 50 seconds. Do whatever you like.
I want to examine and I want to complete my examination by doing respiratory examination.
Okay, as I said, you still have 1 minute and 30 seconds. Do whatever you like. When you are ready, just let me know for the presentation.
Now, can I have the medical records and if there is any ECG available?
Yes, this is ECG. You can review it.
Thank you, Chris. Now I end my examination. You need any help to readdress?
Good. Okay, can you present your patient?
Okay, I examine Mr. Open cardiac surgery as he has a central sternotomy scar. His blood pressure was 120/80 and pulse rate 80 beats per minute, synchronous and no radiofemoral rate. And he has no sign of heart failure. And he has normal S1, S2, and he has also systolic murmur propagated to the axilla.
Okay, and
to the left axilla.
All right.
My top differential is mitral regate.
Okay. And what's your investigation?
Okay. I will order ECG, echocardiogram, and blood investigation like coagulation profile and CBC.
Okay. And how will you treat this patient?
As this patient will undergo a hernia repair, if the patient is low risk for low thromboembolic risk, I will stop warfarin 5 days before surgery, and I will resume it back when the patient starts orally post-op.
Okay. And
if the patient is high risk for thromboembolic, I will stop warfarin 4 days before operation, and I will start low molecular weight heparin 12 to 18 hours before surgery, and I will stop it 6 hours, and I will resume it 6 hours before after surgery, and I will start warfarin when the patient starts to take orally. And my target INR between 2 and 2.5. And I would manage this patient in CCU.
okay. If your patient presented after 5 days with a fever, what you need to consider?
Maybe it's infective endocarditis.
All right. I'm gonna tell you 2 scenarios and tell me what do you think. If you have ejection systolic memo over the second intercostal space, right parasternal, propagated to carotid, what is that?
This is aortic stenosis.
Okay. And if you have metallic click of valve replacement with systolic memo over the apex, propagated to the axilla and accumulate and assimilated in the left lateral position, what is that?
It is mitral regard and metallic valve replaced by metallic valve.
Okay, metallic of.
Excuse me, I cannot hear.
If you have a metallic click of a prosthetic valve, what is that? If you hear a click, if you hear just a click.
I cannot understand you, Dr. Can you repeat for me?
Fine. That's fine. That's fine. Time already finished. And if you have just metallic click, that's Salma, good.
Very good.
Yeah. Intentionally. Okay. I told you my name is not Chris and my name is John, which it doesn't matter. But I just didn't.
Yeah. First, you said my name is Mr. John. Then, when in my mind, that still your name is John.
That's fine. And I could just let this go, but I didn't let it go. I want to stress you out. I want to put you guys at the same situation of the exam. Anything could happen. Maybe the previous examiner shouted at you or whatever. They don't shout recently, but you will feel always the examiner is not happy with you. So that's a normal. That's a normal. And I'm trying not to smile. I'm trying not to communicate with you as the examiner does in the exam. They don't communicate at all. They will be masked face. You will feel like you're going to fail the exam. They will not give you any encouragement. They will not say excellent. They will not say good. They will say nothing. So prepare yourself for that. Can I leave you? When you ask, firstly, your presentation is fantastic. For me, you didn't miss any important point. But when you ask the patient, can I lean you forward? You didn't give him a chance to say yes or no. You said, can I lean you forward? And you immediately lean your patient without waiting for him or her to respond. So just ask a question, wait for 5 seconds, let your patient express, is he agreeing or not? That's the first point. wait for the response, yes. In the warfarin treatment, I think you mix it. So you stop the low molecular weight heparin like in the heparin 12 to 18 hours prior to surgery, and you restart it 6 hours later. I know I can tell you know the answer, but you did a bit of like you confused it a bit. But otherwise, I don't have a major point. Yes,
Salma,
Muhammad.
you did very good job. I am very happy that you explained every step of your examination to the patient. But when you have 1 minute remaining, I'll ask you, do you need to do anything? This is a cardiovascular examination. So if you have a time, do the lower limb, check for lower limb edema. Check for the jugular vein.
I start by checking the lower limb.
Yeah, she said
I
that's the
start my
start, Muhammad.
examination.
Okay.
She said the lower limb edema as
Also,
a start.
in the inspection, you check the face of the patient, malar rash, for mitral stenosis,
Okay.
and for jaundice, for patient may have infected endocarditis, as you said.
I check the eye for
Okay, excellent.
for
That all of my points. Otherwise, you did very good, Salma.
Okay.
Thank you.
Good. So for everyone here, let me see. So examination, we just have anastomotic leak and pulmonary embolism, right, Muhammad? So finish the examination.
Just we have the crisp, and the last session, which is the cranial nerve examination and gynecomastia. All it's 4 stations.
Yeah, but
We
okay.
can deal
So
with these stations by next session, or we can do it now.
Let's do it
I
now
think,
because we have the procedure next week,
I
and
think
we have the procedure next week.
I think 4 station for the next session is perfect.
Okay, but that means we need another day.
Yes, because Sahar, because Asia not attend this session, which may
Okay, I think what okay, that's fine. That's that's it for today. But I just want to ask who's here for June? I think my son Najmuddin is on 6.
Sahar,
So I will.
Sahar for June, I think.
No, mine is in August.
Okay.
August, okay. June we have 2, right, Muhammad? Remind me of our time table.
Asia. Maysoon, Asia, and
Ahmed and Saleh.
No. Saleh for August.
Okay, I will review it later. So our next session will not be procedure skill. We still have 3 or 4 of the examination
4 sessions, yes,
that we need to finish. So we will insert another session.
So please note, we have cranial nerve examination, gynecomastia, anastomotic leak, and pulmonary embolism.
Okay, and I want okay right now which one you want to do? The session will be tomorrow, and I'm gonna rearrange the session. Okay.
Yes.
That's it for today. I think that's a good
Publish it
presentation.
in the Medical Plus in the Telegram.
Yeah, I will publish it after the right. Yes, that's a good presentation for today. Everyone performed very well.